we have people in charge of health, biomedical research, surely making public health political, but taking it in the direction that they always wanted to from the beginning of the pandemic, which is to make us sicker, less healthy, and less able to sort of be active citizens in the democracy that we are holding on to by the skin of our teeth.
Well, hello and welcome back to In the Meanwhile, the podcast where we are as shocked as you are to be getting updated vaccine guidelines from the guy who told you to inject bleach. I'm Marcus Harrison Green.
And I'm Nora Kenworthy. I gotta say this week was a tough one. I was gonna say it was a tough one for people in public health, but I think it was actually tough for anyone who took middle school science classes or doesn't want to get polio in their lifetimes.
Or just, cares about, I don't know, things like not dying. I don't know.
Yeah.
That too.
Yeah, that too. Yeah. I mean, I feel like very little shocks me about this administration and how much they hate people being healthy anymore, but it was really wild to see that full lineup of snake oil hucksters and Frankenstein lookalikes up there at the press conference on autism earlier this week.
Yeah, no, I gotta tell you, I remember in college during the George W. Bush era, telling my roommate, who was a Republican at the time, that all I wanted was a president who had an IQ above room temperature.
Ooh.
Was that too much to ask? And you know what? It was. Because I'm realizing that I was setting the bar way too high on that one.
Truly way too high. Similarly, I was actually thinking this week back to the George Bush Sr. years. Do you remember when he got caught saying he didn't like broccoli and that he wouldn't ever eat it? And it was the scandal of the year that he wouldn't eat his broccoli. That was the kind of health problem that we were dealing with.
The beta carotene and so forth from the broccoli was that was that was the scandal of the day. And these days it's would that even be a Reddit subthread? I don't think.
No. I mean, the best vegetables that our current president gets are old ketchup packets, I think.
That is true. The condiments are I think that is where he derives his nutritional value at this point.
Whatever it is that keeps his coloring looking so healthy.
I gotta say, rewatching bits of that press conference, I can't imagine who would actually want to put their trust in our current goon squad with health information. You got Trump over here. He's looking like a hot dog at the end of an 18-hour shift in the little roasting cabinet at 7-Eleven, standing next to the guy who hung out with a dead baby bear cub and said on the record, maybe that's where I got my brainworm, quote unquote. And then not to mention that RFK Jr. has taken to swimming in actual shit by taking his grandkids for a nice dip in DC's sewage-filled Rock Creek. You make it make sense, Nora. Make it make sense, because it doesn't.
I think the thing is, though, it does make sense. All the poisons in their systems have come out to play, and they're holding a news conference.
I gotta ask you, Nora, how you obviously you are a prominent, esteemed public health professional.
I'm making faces as you say that.
I gotta ask though, how, just in terms of how the news was covering that press conference and sort of the aftermath and fallout, what did you think? I was just I was can't they just say that he's actively spreading misinformation? They kept trying to couch it as, well, that's not entirely accurate.
And we're gonna call up 3 experts to prove to people that Trump doesn't know at all what he's talking about. I mean, I think this is the sort of hype loop that we've been stuck in with public health and the media since, early COVID days, if not earlier, and the Trump administration, where part of the point is for him to say something patently absurd. And then the media gets into this hot frenzy. And then to implicate my own field, all the medical experts and the public health experts also get into this like hot frenzy where we're like, well, that's just, I'm going to debunk this like with all my research citations and everything. And I'm very upset. And I
Yes.
think part of our job right now in this moment, I think, is to recognize this for what it is, which is, I think this is more of Trump giving his followers a litmus test
Mm.
of like, if you truly follow me, if you
Yeah.
truly believe me, you're going to swallow this stupid pill, knowing how stupid it is. And then you're going to show up to your doctor and you're going to demand things like ivermectin or whatever, right?
Yeah.
And I think it's the same way that people have been showing up to Starbucks all week and like ordering lattes under Charlie Kirk's name just to kind of like see the liberal outrage play out. And part of it is about the outrage cycle.
Right.
And part of it is about sort of demonstrating this kind of like belonging to the cult of Trump that I think has nothing to do with what people actually believe or possibly even what they're doing in their own homes. It certainly has nothing to do with the science.
Yeah, if only it wasn't corrosive to public health, democracy, I don't know, like sanity. Like you know what I mean? It's like I just it just seems like we're going back into such arcane times, right? Where like at the dark ages or something. And I want to be clear that it was dark ages for certain continents, not others.
Yeah.
But where it's like you're like you're basing it on some like just very sort of antiquated like pseudoscience where you're seeing if people float or whatever, and if they sink, they that well they were cured of demons, which was
Yes.
epilepsy or whatever. And it's like it didn't work out too well back then.
No.
Like maybe us going back to a sort of feels and vibes. I believe that President Trump said during the press conference that this was like he felt that this was right or whatever. It had nothing to do with any type of peer reviewed science. And it's like that's dangerous in general, but specifically in medicine, I would think. I don't know.
Yeah, I mean, but I think that like, I'm not sure this has ever been about the science. I think, much like the witch trials, it wasn't actually about the evidence. It was actually about the punishing of women. And, this is about punishing women. It's about punishing
funny how it
disabled
comes
people.
back to that. I'm noticing a theme of the last 250 years. Nora.
Yeah. I do hope that this unleashes the absolute rage of any person who's had a baby and Trump telling them to tough it out while they're pregnant. Because like, unless you've been pregnant, you don't understand quite how many things you don't have access to. Like Tylenol is it. That is all you get. Like no matter how bad your pain is or like what your symptoms are, your doctor's like, well, you can have some Tylenol. Because literally no one has ever done research trials on what drugs actually are safe for women to take during pregnancy. So Tylenol's it. That's all you get. I think for me, like for many people, the cherry on top was Trump trying to pronounce acetaminophen.
Oh my God.
It was something like acetaminophen.
Well, let's see how we say that. Acetaminophen.
Right. Like I kept thinking, like, is he pronouncing it ass-head-of-men? Or was that just my subconscious filing an HR complaint in real time? Because it didn't seem, whatever he was saying, it seemed a little off. Okay.
I do have some concerns about ass-head-of-men. Like, it has been causing me chronic stress headaches and stripping me of my reproductive rights.
Well, since around 1776, I believe. Nora. Well, maybe, Nora, Trump can blame his Truth Social message to Pam Bondi on ass-head-of-men. Because least we forget, Trump and his cronies have been committing impeachable offenses like it's a game of Pokemon Go. And it's like you got to collect them all or something. I don't know.
Yes.
I have no idea.
It's
crazy.
like, I don't know, Racket TV or Pajurtle or something. I don't know. There's a special one for boats off our coastline called Shoot-a-Choo.
Jesus,
Is that too much?
That may have been into cancel territory, Nora. I don't know. I will.
It's fine. Everyone's getting canceled now.
And then uncanceled in the span of a few days.
If you're a white man.
Yeah. Well, yeah. It's The only way to be uncancelable, I guess, is would be with that'll get you the card that is uncancelable, as we know. But anyhow, Nora, I gotta say, the worse the news cycle gets, the worse our jokes continue to get. I
I know
think
you
it's
said
just
our, but you meant your.
I'm trying to be nice. I'm taking one for the team, Nora.
I
But
didn't train as a comedian.
wait,
I know that's surprising to hear.
I would not have guessed that. I would not have guessed. No, in all seriousness, though, even for the Trump administration, getting caught accepting bags of cash, greenbacks by FBI agents, and literally tweeting out collusion with the Justice Department. I mean, that does feel bold, even for them. Like, it's like, just here's the corruption in plain sight. You can do nothing. Here we are.
I know,
right?
all of that in one day too. And I keep thinking, like, if this is what they're doing to distract us from the Epstein files, like, can you imagine what's in that box of horrors?
I so shudder to think, like, truly, yeah. Folks, given all of that, we wouldn't blame you if you missed some of the news this past week related to public health. Actual public health news, I want to say. It was like infrastructure week, except for bringing back arcane and completely preventable diseases.
Yeah, it was like, welcome to diphtheria and consumption. Now, just to recap, right? Late last week, we had a meeting of the Advisory Committee on Immunization Practices, or ACIP, which most of us have never heard about because we didn't have to worry about it until a few months ago, because there were actual adults in the building who were like doing their jobs. But now it's like a clown car has pulled up outside the CDC and a bunch of conspiracy theorists are all piling out of it. And so on the second day of their meetings, the chairs started off the meeting by saying, we are all rookies, and then reversing a decision that they'd made less than 12 hours before. And this was all
Wow.
prior to the Trump press conference fiasco that we had this week.
That is truly confidence inspiring. Let me tell you, it sounds like real stupidity super spreader event. It just
Yes.
yeah.
Yes.
It
has been a week.
we did
For
you know
people in my field, it is just a doozy.
Brother, I gotta say, like, the crazy thing is, right, there's all that has happened this week, right? And the things that we have not touched on just because we don't have the time, but yes, it was definitely that type of week.
I think all of this is why I'm so, so grateful to have today's guest here with us to
Yes.
try and make sense of at least one of these clown shows.
Yes, one of.
Yeah. And understand the broader fight that we're in when it comes to the politics of public health in the US. So to me, as someone who also is in this field, Gregg Gonsalves is like a deeply trusted voice of truth and one of the most effective organizers of resistance to harmful public health policies that I've seen. He's willing to say it how it is. He's willing to get into political fights on behalf of all of us.
Oh, thank God.
Yes. And he has this like 30-year plus history of HIV activism and organizing that really is the grounding of everything that he does. And so I could not be more excited or grateful to have Gregg on the podcast this week.
No, that's absolutely true, Nora. This is definitely the perspective we need right now. Dr. Gregg Gonsalves is an associate professor of epidemiology at Yale School of Public Health, where he also co-founded and co-directs the Global Health Justice Partnership. He received his BS in ecology and evolutionary biology and PhD in public health from Yale, and his work focuses on improving the response to infectious diseases and advancing health equity.
For more than 30 years, Dr. Gonsalves has worked on HIV/AIDS and other global health issues with several very important organizations, including the AIDS Coalition to Unleash Power, the Treatment Action Group, Gay Men's Health Crisis, and the AIDS and Rights Alliance for Southern Africa. In 2018, to really cap things off, he was awarded a MacArthur Genius Fellowship. And today he serves as a public health correspondent for The Nation magazine. Gregg, thank you so much for coming in and chatting with us today.
Happy to be here.
So your work is rooted in this 30+ year history as an AIDS activist. This is not the first time I imagine you've seen a government deliberately abandon its responsibility to protect the health of the public. I'm wondering if you can kind of talk to us about how your experiences as an HIV activist shape the way that you perceive and approach what's going on in the Trump administration now.
Well, that's a big question, but I'll try. So like I grew up in the 80s, in the um, very start of the AIDS epidemic in the United States. Um, it was also the rise of modern conservatism as we know it with Ronald Reagan. Um, and for those who don't know the history of the epidemic back then, President Reagan didn't mention the word AIDS in a public press conference or meeting until 7 years into his presidency. There was really uh, neglect by the federal government, but also sort of a real disdain and um, lack of concern for the people who are affected by the disease. There's a short documentary called "When AIDS Was Funny" that is available online, which captures Larry Speaks, the former deputy press secretary, laughing in the Oval Office about people having AIDS and whether any of them were gay, and like, so it's really a bad time, and thousands and thousands of people died. Many of my friends died, and it didn't feel like the government really gave a damn whether we lived or died. Um, we organized through ACT UP, the AIDS Coalition to Unleash Power, and other direct service providing groups like Gay Men's Health Crisis, AIDS Project Los Angeles, other activist groups as well, to push back on the sort of broad range of responses that we needed for HIV, whether it was for care and prevention or for research. Um, I'd like to say it got better, and it did a little bit under Bill Clinton and uh, future presidents, but it was never a priority for any of them. Many people think of the Clinton HIV/AIDS initiative and his work after he left the White House, but during the White House, he was not a particular champion of AIDS research or prevention and care. It was really a Congress that was motivated to do it. Um, I also lived in South Africa in the 2000s, where this was deja vu all over again because you had a president who thought HIV wasn't the cure, HIV wasn't the cause of AIDS, and AIDS drugs were poison. And so you had 6 million people infected with the virus who had no recourse from their own government. They organized as well through the Treatment Action Campaign and the larger coalitions they were part of. And so, in the face of one disease on two continents, people organized to try to secure what they needed from governments that really didn't want to give them what they deserved.
Greg, again, pleasure to meet you. There's this common refrain that to be effective, public health, can't get too political. But yet, in your career and certainly in the years of the COVID pandemic, I think it's shown that getting political is essential to effective public health interventions. So I do wonder, as you teach the next generation of public health experts and policymakers, what is it you want them to understand about the role of politics in public health?
Marcus, I think it's a really important question. So, the idea that public health shouldn't be political is a modern or contemporary notion. If you look at the history of public health in the 19th century, we were campaigners, we were advocates, whether it's for clean water and sanitation, for better building codes that protected you against respiratory diseases like tuberculosis, um, a shorter work week and better occupational conditions in the factories of the Industrial Revolution. This is what public health did. They weren't sort of technocrats. They were campaigners for social and economic changes that allowed people to live healthier lives. It was only in the beginning of the 20th century when medicine sort of took over public health and it became sort of a technical profession. And the big picture of what makes us sick, makes us healthy, was sort of delegated to the sidelines. And there's a book called The New Public Health by Herbert Hill that came out in the beginning of the 20th century that makes that case explicit. It says we know how the body works now. We know how microbes interact with the body. We don't need to deal with these other big picture items. And historians of public health have been pretty good about documenting this trajectory of public health and how it's developed over the past 2 centuries or more. And really, we arrived at the end of the 20th century with a public health system that was really the poor stepchild of biomedicine and healthcare, underfunded, under-resourced, with very little respect. And so when people say um, public health got political during the pandemic, it's like, I ask, where have you been? Public health has always been political. It's not about, pills into bodies or your one-on-one interaction with the doctor. It's about how we keep society safe and healthy and flourishing. Um, I will say that I think it's not a coincidence that we talked about public health being too political, um, and how that narrative sort of took shape. I do think, people like Walker Bragman and others have talked about how a lot of money was poured into um, uh, organizations that fought things like mask mandates or vaccine mandates, that really sort of turned, whose explicit agenda was to turn Americans off of public health and to target public health during 2020 to 2023, 2024. Nobody talks about it because it sort of happened in the dark shadows of sort of dark money in American political life. But, the idea that public health shouldn't be political is basically saying stay out of it, right? We don't want you part of the sort of national discussions about what creates health and wellness in America. And we've seen it sort of become political in a way that they want, um, you know, in these last, 8 to 10 months, where we have people in charge of health, biomedical research, and others that are surely making public health political, but taking it in the direction that they always wanted to, from the beginning of the pandemic, which is to make us sicker, um, uh, less healthy, and less able to sort of be active citizens in the democracy that we are holding on to by the skin of our teeth.
Yeah, absolutely. Um, I You've been writing some incredible columns recently for The Nation. And in one of your recent columns, you really called for Americans to understand that the current struggle we're seeing under this administration to save public health is actually a much bigger battle to save democracy. So, in that piece, you wrote, the struggle to save public health and biomedical research in the US cannot be seen as a single issue fight. It's part of a global battle against the anti democratic forces that have been at play around the world and are now thriving here at home. Can you talk our listeners through a bit more of how you see these fights as inseparable?
In two ways I'll do it. One is that autocrats everywhere, from the United States to Viktor Orban's Hungary to Vladimir Putin's Russia, to other periods in history, do not like expertise, and they particularly don't like universities, right? And so, sources of knowledge and critical thought are poison to them, and they need to be disposed of in any way possible. And so, the culture of expertise that sort of puts a mirror to society and says, this is what's happening, this is why it's wrong, here's the evidence to show you such, needs to get rid of in the context of an autocratic government. I think we also have to talk about how public health and medicine developed in America, right? And there's a piece in this New York Times Magazine, um, can't remember how many years ago, by Janine Interlandi, that said, why doesn't the U.S. have national health care? It all has to do with race, and it's about how we've described who is deserving and who is not deserving in this country. There's a book um, called Dying from Freedom, that was written a few years ago about the smallpox epidemic that happened after the Civil War in the United States. Many people would say, what smallpox epidemic that happened? Actually was not really described in the history of this country or the history of public health. And there's only one. Um, uh, it was discovered in older records that we had to make a reckoning about how we basically wiped an entire sort of outbreak epidemic off the sort of history rolls in the United States. The way we set up hospitals in the United States, at the end of World War II, when Truman was talking about expanding hospitals in the United States, it was clear that there were not going to be um, uh, uh, a national investment in hospitals. Southern senators got to pick where those hospitals went, and guess where they went? They went to predominantly white districts and areas of places in the South. So we created a set of vulnerability that's specifically based on race in the United States, which leads you to sort of um, the, the current moment where our anti-democratic authoritarian forces in the U.S. are completely tied to um, our sort of enduring national commitment to white supremacy and other sorts of forms of discrimination. So that's where I think democracy and the kind of place we want to live in is totally tied up to the future of public health.
Absolutely. This reminds me of another point that you make in your writing where you argue that epidemics are human creations and that, as you put it, we hang together or we hang separately. So, can you help us understand what a more truly intersectional pro democracy public health movement would look like in practice here in the US, despite all of this racial division and all of this really divisive history?
So we are 44th in life expectancy, or in the 40s life expectancy worldwide. Um, and Elizabeth Bradley, who used to be professor here at Yale School of Public Health, who's now the president of Vassar College, wrote a book called The American Healthcare Paradox. Why are we facing this sort of unequal um, health outcomes when we spend more than anybody else per capita on health across the globe? And a lot of it's about um, what we call social protections, not just national universal health insurance, childcare, elder care, you know, addressing housing and all these things that we would call the social determinants of health, right? And so, you know, these are things that the Make America Healthy movement will never describe and never discuss, right? It's all about you and about your personal behavior that leads you to ill health. Um, But if we're going to build a democratic movement for public health, it has to be tied to this sort of larger set of aspirations around social protections in the U.S. Whether it was the Second Bill of Rights that FDR talked about towards the end of his life, that it's not just about freedom in its sort of classical sense of freedom from interference by the state or by other kinds of actors. It's the freedom to live a life that is healthy and flourishing, which requires um, an architecture of care that is not the basis of our economic model in the U.S. None of us, rich or poor, is thriving in this brave new world of the 21st century. Everybody's trying to sort of keep their head afloat, except for people at the very, very top.
Yeah, Greg. So it seems like it's nearly impossible, obviously, to talk about the disintegration, if you will, of the public health sector without talking about Robert F. Kennedy Jr. And you did so in a recent column for The Nation. You actually highlight a chilling letter that Carolyn Kennedy wrote about her cousin, Robert F. Kennedy Jr., in which she portrays him as a predator and describes his psychopathic tendencies. I believe one very vivid anecdote is him putting mice in his blender, to feed his cat or something. And isn't a person that I would want as a plumber, let alone the Department of Human and Health Services here. But anyhow, we have seen how RFK has brought that dehumanizing predation to HHS and to the CDC, and by extension to the American people. So why do you feel it's important that the public truly understands a man that you call a new American psycho?
So RFK is sort of the worst case scenario of the sort of id of the Trump administration, right? He doesn't want anybody to be healthy. He's pulling vaccines away from people. He's shutting down cancer research programs. They're tearing apart um, every single program that could possibly be um, um, central to the America's health and wellness, from CDC to NIH to FDA, etc. Um, you know, when I went back and looked at Caroline Kennedy's letter, you saw a sadism that sort of is at the heart of who this man is. He was putting chicks and mice into a blender to feed his birds of prey, right? And she said, it doesn't surprise me that he carries birds of, he owns birds of prey and raises them because he's a predator himself, and talks about this really dark period in the family's history in which he sort of took people down to his lair and introduced them to sort of drugs and um, other debauchery, in a way that she felt was just sort of like really sort of predatory. I want to be clear that I'm not talking about. Um, I'm not targeting people who use drugs or drugs themselves as the issue here. It's his predatory um, behavior to the young people in his family, which Caroline Kennedy sort of lays out there in sort of gory detail. Imagine what it means. Like, think of relatives who like you may not like, but like you just deal with them on family holidays and things like Thanksgiving. For her to put that out there in such explicit terms means she sees the danger in sort of apocalyptic um uh, uh in an apocalyptic framing, because he is that bad, that dangerous, that hazardous to our health. Then we have Russ Vought in the White House, who's um director of the Office of Management and Budget, whose daughter has cystic fibrosis. Several years ago, his wife, or his ex-wife, went on social media to say this new drug for cystic fibrosis is such a miracle for us. The biomedical revolution that gave birth to it really is something that has really saved our child's life, and she waxes quite eloquently about the role of biomedical research in saving her daughter. 5 years later, her ex-husband is destroying the very sort of foundation of what has provided the drugs that have kept his daughter alive. And again, we get back to a sort of um, essential sadism of Russ Vought. There's a ProPublica video of him saying, "I want civil servants, I want people who work for the government to be traumatized. Right? I want them to be unable to do their work." It's like, who are these people between RFK and Russell Vought? Um, Russell Vought, who claims he's a Christian, but has this sort of um, you know deeply sadist streak, in which he is really inflicting enormous pain, not just on civil servants, but on the American public in the way he's dragging down everything that makes our lives possible.
Yeah, Greg, and I know maybe this isn't your wheelhouse, but we've just seen such a lack of empathy, from folks in this administration, even though they claim to be, either Christian or what have you. Wh- why do you think that is, that there is this attack on basic empathy and seeing each other's humanity?
I don't know. I'm not a social psychologist, but the reason I put out that Caroline Kennedy letter for the centerpiece of the article I wrote for The Nation is because what I see is sort of deep sadism and nihilism, that is part of this government, in addition to sort of greed and extraction and corruption. And when you look back into history, it's not as if you didn't see these kinds of sadists um, before. If it's Joseph Mengele and others during the Nazi years, like, dictators and authoritarians do not attract the best people, as President Trump might say. He's really surrounded himself with a pretty coterie of sociopaths and psychopaths in certain senses, and the nation's going to pay for it for more than a generation. We're not going to dig out of this, you know, in the midterms or in the next presidential election. The damage they've done is going to be lasting, and it's going to affect our children and our children's children.
Yeah, I mean, that's where I wanted to kind of push on this next. I mean, it's worth saying that there are plenty of people who are bearing the acute brunt of the current cruelty, whether it's cancer patients who are getting dropped from clinical trials or, you know, older people who can't get the vaccine for COVID right now. But I think part of what you're trying to get us to focus on is also that it takes a very, very long time to rebuild public health institutions. And been a massive dismantling of the sort of core heart of institutional public health. So, what are the long term effects that you're most worried about, that you're really concerned about as you look forward for the next decade or 2 decades?
So, I'm an NIH funded researcher for now. And NIH funded research didn't save just Russell Watt's daughter's life, it saved my life. I'm HIV positive. Um, I'm on drugs to treat HIV infection, and I have been for many years. But for cures that are going to be needed down the line, for any of our family members in this generation or the next, the cures that could have been possible are now being foreclosed upon, right? When you shut down a research lab, you don't just turn it on with a flick of a switch. People have lost their jobs, experiments are ruined, and what we're going to see is that there's a whole generation of lost promise in terms of new cures and treatments for disease because people have gone off into uh, more safer professions in an industry, or they've rerouted their entire lives away from biomedical research. So we're not going to be able to rebuild these labs by the flick of a switch, even if we have a new president in 4 years, etc. Um, so that's one piece of it. They're dismantling the ability to generate new cures for diseases. So, and that's going to last. We're going to have a lost generation of researchers. People who are in graduate school now who want to be researchers do not have a path forward, right? So we're going to empty out this current generation of potential researchers who could provide us with cures. That being said, the CDC is being gutted as well, and all we need to see is that what happens if we have a new um, pandemic arise in the next 4, 5, 6 years. We'll have destroyed the infrastructure at CDC that's devoted to detecting and handling these kinds of outbreaks. We'll have destroyed local public health departments because they depend on the CDC's funding for many of their activities. So we are basically pulling the rug out from underneath the future and the present of public health and biomedical research, which I don't think people understand it quite um, directly at this point. Um, but we like to say like nobody thinks about public health until something goes bad. If something goes bad, we were going to be in a worse situation than we've ever been. We didn't start with a great baseline in 2019 when the pandemic hit us. But if H5N1 or something else hits us in the next 2 to 3 years, um, it's going to be much, 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 much worse.
Yeah, is there? I mean, I'm just curious to get your take. Is there a sliver of hope that RFK's extremism could be his undoing? Like, we have seen some backlash towards his policies in the last few weeks, and even Trump, for as much as it's worth, I guess, has said that he might have gone too far. Uh, can you walk us through what is working to resist the dismantling of public health institutions at this moment, if anything?
Well, I think a lot of public health people are finding their roots and are fighting back. We have a new group called Defend Public Health, which has about 5,000 members across the country, who are all laser-like focused on not just RFK, but the entire sort of dismantling of public health in America. I think biomedical researchers feel the same way in terms of the dismantling of the NIH. So I think there's organizing going on. I think there's a people-powered movement that's arising that is trying to challenge RFK and the rest of the sort of set of rogues gallery that we have in Washington D.C. It's hard, but we need to do it in a way that realizes we're going to have to keep fighting, even though that things look sort of terrible and dark right now. Defend Public Health wants to set up 25 state teams around the country. Right, we want to build power on the local level to take back what they've taken from us now, and that's sort of good old fashioned, shoe leather community organizing, which we all going to have to do. We put a lot of faith in sort of our politicians to do the right thing. It's clearly not the case now, and even our politicians we might support don't seem to have the fire in the belly for this fight. But I think a lot of people out around the country do that I talk to, and I'm on Zoom calls with, every other night.
Exactly. I was looking over some recent polling data that the Kaiser Family Foundation released around Americans' perceptions of vaccine guidelines and childhood vaccine um, policies. And it was pretty shocking to see that even in this current climate, 8 out of 10 Americans overall support, childhood vaccine guidelines in the schools. I think it was like 73% of like MAGA Republican voters support vaccines for children in schools. Um, it seems like the political discourse around some of these issues is so far from where Americans actually want it to be and where they actually are. Um, and so now we're seeing like states moving to try and individually or collectively kind of counteract the administration's vaccine guidance. I, it the chaos of the moment, particularly around these kind of hot button public health issues like vaccines, feels, I think, very disorienting to the normal voter. So, what is your guidance to everyday voters, people who listen to this podcast, in terms of what they can do to bring policy discourse back to like the reality of where American voters actually sit?
One is to no matter where you are, red state, blue state, purple state, is to bring it home to your representatives, right? If they're anti-vax, you know, let them have it. If they are pro-vax, but they're not speaking up and making this a priority issue for their work in Washington, D.C., tell them they have to do more. The point is that we're in a situation where, you know, um, we may see the return of dreaded childhood diseases that we thought we put in the past. The Texas measles outbreak is a bit of a um, odd situation that has to do with the sort of the characteristics of the religious community in West Texas. It's not clear, that RFK had necessarily a role in its genesis and its start. But people like Joe Ladapo in Florida, who are saying we need to get rid of all childhood vaccine mandates, that entire thinking is going to put us in a situation where, you don't need coverage to get super load to have outbreaks of disease. Nathan Lowe, who's a friend of mine at Stanford, did a paper um, a few months ago that said things like polio, diphtheria, measles, others can become endemic with with a certain dip in immunization rates. So the way things are going now, the way in which RFK is sort of going step by step through the sort of vaccine policy pipeline to sort of explode each piece of it, um, it can easily tip us over the edge and put these dreaded diseases out into the public domain, which we haven't seen for many, 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 many years.
Greg, you've already mentioned, and I know you've sort of written fairly extensively about how authoritarian governments, whether it's Poland, Turkey, Hungary, have targeted universities and public health systems as part of a broader campaign to suppress dissent and to consolidate power. So, are there any lessons, from these international examples that you think the U.S. public health community and, quite frankly, just pro-democracy advocates need to urgently adopt before it's too late?
You know, it, all of them have been about people power, right? In Budapest, there were hundreds of thousands of students on the street several months ago. Um, you know, we watched the Berlin Wall falling without a shot in 1989. We need to figure out how to organize. And I know on October 18th there's the No Kings next protest, but we need to be able to organize in our communities and organize in a way that builds larger groups of people who can do what the right did, um, which is to move from um, your local school board to your city council to your state legislature to your governorships and build power to bring us back to some sort of rational sort of public health discourse in the United States, but also sort of enshrine the democratic values that we thought were just sort of forever values that would be sustained without our impact. Many people know that it's never been a democratic country for many, many people, um, but now it's pretty clear that we've slid into sort of an authoritarianism, which is unlike any other period in our history, and it's going to be about people power. It's going to be about doing our work to organize in our communities. And, some of it will be on public health, some of it will be on immigration, some will be on reproductive rights, some of it will be on straight up, democratic issues like, the courts, etc. But there's no way out except through community organizing. And, you know, it's what we did in the 19th century in public health. We organized and we marched and we campaigned for all the things that we take for granted now, whether it's clean water or, you know, safe workplaces, etc. And we just have to go back to it. Edward Young, who wrote for the Atlantic during the pandemic, um, wrote a piece called "As Has Public Health Lost Its Way," um, and talks about, you know, the 19th century as a lodestar for the kind of work we need to do now. We have to sort of recover our roots.
Um, and I think it's worth noting that the kind of organizational efforts that you're talking about are not just showing up to a march once every 6 months, but it's really that like deep community roots organization that we've seen in, for example, some of the groups that you've worked in the past, like ACT UP and the Treatment Action Campaign. Um, we've seen over the last couple of weeks some pretty high profile forms of resistance from, resignations from top CDC officials and stuff. But where would you like to see listeners and everyday people directing their advocacy efforts around public health right now in this moment?
I think you're right. It's really important to tell people it's not going out to a march, or it's not going just out to a march, right? It's not just signing a petition. Um, what it is sustained organizing for power at the local level. You know, talk to your neighbors. Did you know what the vaccine policy is now of the federal government around COVID vaccines? Or if you're in Florida, you know, do you know what our Department of Health just said? Um, you know, there's many people actually have no idea what's going on, because they're not in the midst of like they don't work as a researcher, so they don't know what's going on with NIH, or they not with a public health department, so they don't know what's going on with CDC. You know, the impact of it hasn't come home to them. Um, but for those who know, they have to spread the word. And it's, you know, if you're religious and you go to church or synagogue or a mosque, you need to be able to talk to people in your congregations. You know, if you're part of a civic organization, some other kind, you need to talk to your fellow members of the organization, talk to your neighbors, and then figure out how you're going to get together and make a difference. And it, you know, it doesn't have to be, you know, everybody in your town marching to city hall. It means like six of you go up to the city council hearings or to the state legislature and say, let's talk about vaccine exemptions in our state and how we have too many people sort of slipping through the cracks now. You don't need a lot of people to do certain things, but you need to build enough power so that people will listen. You know, having a few noisy people is fine, but you need to be able to say that, you know, my state senator, my state representative, knows that my town is pro public health, knows my state is pro public health. That means you need to sort of organize across the board and organize communities and not just on issues.
Well, Greg, I hope this question doesn't come across flippantly at all. This is not intended to, but at the end of every episode, we Nora and I share our 8 ounces of joy, meaning like whatever we're able to squeeze out of some light that we're able to squeeze out of these very dark times we live in. And so I wanted to uh, put that question to you, like, what is sort of allowing you to find some level of light or joy in these times that are so heavy?
So I know this is going to sound weird, but my dog, but you know, this happened during AIDS, it happened during COVID, it's happening now. People come out of the woodwork. There's so many wonderful people who I did not know 8 months ago, who come into my life like on a more than weekly basis, um, about organizing this or organizing that. And it makes me feel hopeful because I'm not counting them like on the fingers of one hand or two hands or my fingers and toes. There's hundreds and thousands of people who are out there who are looking for the match to spark this. And so I think, maybe in January I was depressed. Um, Maybe I was angry in March and February, but now I feel like we can, you know, we will win. These kinds of folks never sustain their sort of reigns of terror. It's not going to say that a lot of people aren't going to get hurt, people are going to get killed, but people are going to get sick. Um, but I do think like history is on our side.
I'm an atheist, but I'll say amen to that. Yeah.
Yeah. Your words also remind me of the kind of I don't know who this is attributable to originally. Maybe you know, Greg, but the kind of adage from the kind of AIDS protest movements of like we bury our friends in the morning, we protest all afternoon, and we dance all night. That our joy and our resistance and our grief are all tied up together.
Yeah, I agree. I mean, it was the height of the AIDS epidemic in the U.S. was ghastly, but you know, there's a lot of love and laughter even in the midst of that.
Well, thanks for giving us lots of reminders of why this fight is so important right now, and thanks for taking some time to chat with us.
Always, thank you for having me.
Well, Nora, I gotta say, I think, I don't want to speak for all of our listeners, but I damn sure know that as somebody who re-listens to our podcast after its release, I definitely needed that right now. I just needed some level of confidence that there are public health professionals out there who
There's
aren't
dwindling few.
promoting pseudoscience and their and their witch hazel, so to speak, on on their website for you to buy. So thank
Yeah.
God. Okay.
Yes. I think it's really good to know that there are so many professionals in so many fields that are fighting the good fight right now. It feels hard to keep track of all of them, but I think it's good to know that people are leveraging their expertise
Yes.
on the side of good right now.
Absolutely.
And I'm really
Absolutely.
grateful to Greg for all of his work.
Yeah. If only they were in the federal government. But that is another podcast conversation for another day. Um, that while we're like in some good vibes right now, why don't we move on to our 8 ounces of joy for
Yes.
this episode? I want to go ahead and start first
Okay.
today, Nora. So, this weekend it was my 25th reunion for high school, and I had a absolutely miserable high school experience. Like
Same.
I have had nothing good for these last 25 years to say about my high school. I literally you could be I think it was you could be truant, meaning like you could miss 20 days of per year of high school before you would have to automatically sort of either repeat the year or go to summer school. And so every single year at my school I would go up to like 19 and a half days because I hated it so bad. At the end of every single year I would ask my parents, I would beg them, please can I go somewhere else?
Oh.
And unfortunately no. They worked 2 jobs apiece to afford my tuition to go to this private school, and even at that they ended up not being able to afford the last 2 months
Ooh.
of my tuition, and so my high school never released my high school transcripts.
No.
And that made it made it a little difficult to get into college, you would think. So so good shout out to Cal Lutheran University.
I was just gonna ask if you wanted to give a shout out there.
Yeah, they accepted me just on the basis of my SAT scores and essay alone, and I will always be grateful to that school. Calu, it's imperfect like any other high institution of learning, but my God, I will love them until my dying day. So that being said, and folks were asking, where was I gonna go to my 25th anniversary? And I literally was like, if it was between going there and Charlie Kirk's alleged funeral, I might have been in the first row with pyrotechnics spraying on my face, right? Thankfully, though, I did actually have a prior commitment. It was ironically enough for me, and I'll tell you why it's an irony. I was giving a speech for Kubota Garden's annual gala, and Kubota Garden would have made it special for me. That was the place that I would retreat to in high school a lot, where skipping school, skipping class to just go to. And just
Can I just say, what a great place to skip class.
Yeah, I'm telling. I mean, I obviously
like, you
get
have
your
good
education
taste as a high schooler. Like you weren't at the 7-Eleven. You were like,
it was free to go to. There weren't a lot of truant cops there, so it was it was also very deliberate. But I will say, it was always this place where you could find peace. And as I said in my speech to folks, it was a place where you didn't have to have a $1, or you didn't have to have status, and you could go there and behold beauty, like when you needed beauty in your life and you needed peace and you needed calm. And that was a place where truly, on the day that I'm that other people are celebrating 5 years of high school, which is a formative experience for them. I was celebrating what had been an formative experience for
Yeah.
me during that time period, and it had always brought peace to me. And I noticed that specifically when the day after reunion, looking at a photo of former classmates or whatever, who had taken a photo at the reunion, and I was expecting to feel bitterness and resentment and everything. And I looking at the photo, and I feel none of that. I just feel this peace, right? And this bitterness that I had been carrying for 25 years it was just gone, right? And most of the people there, they seem like good stand-up folks. The ones who aren't, I just have unfollowed through the years on Facebook for some of their, shall we say, controversial social stances. I'll just leave it at that. And I'm being diplomatic today, and because of Jimmy Kimmel, he's inspired me. But the 8 ounces of joy part is that I just realized how much Kubota Garden is still giving me peace, right? And even the fact that it was able to help me to sort of come to terms and make peace with the place that I had for the longest time held a lot of bitterness for. I think, to me, that's just my ode, and my joy is to these third places in life, that are home to us and that we view as home. And as I said in my speech, the Kubota Garden, it made me quote. When I think of that, I always think of the quote from the Indian mystic poet Rumi, who says, just whether you're a wanderer, worshiper, a lover of leaving, even if you've broken your vows 1,000 times, this is a place that you can return to over and over again. And so, I just I would advise anybody, and I know it's harder to find third places these days as capitalism runs amok, and places where you don't have to have any type of money or any type of agenda to go to are few and far between. But I would say if you can cultivate a third place that is yours, and just it is truly an accepting place to you, please do. So that's my 8 ounces of joy for today.
I love that. And I also have to say that Kubota Gardens in particular has been such an important refuge for me in my life as well. It was one of the places I went to most frequently during the early days of the pandemic. It was open. And it just brought a lot of peace into my life at a time that felt like profoundly disruptive, and we're so lucky to have it. So
absolutely,
I love that.
Yeah.
More places that bring us peace, unlike all the other places.
Not that we don't need it in this time period.
Week,
what's yours, Nora?
I love how there's these weird parallels between ours, and they're often like these weird oppositional parallels. So mine is actually about running into an old friend. I had to take some cross-country flights this week as I was traveling, and a friend reached out to me and was like, hey, I'm coming through Seattle. This is like one of my best friends from college. I'm coming through Seattle, but it's going to be so short, and I don't know if I can see you. And I was like, I'm actually flying to New York that day. And she goes, you are? Because I am too. And I was like, oh yeah, well, what flight are you on? And it turned out we were on the same flight.
Wow.
This is someone I haven't, I see her in passing. We're both insanely busy. We live in opposite sides of the country. We never get enough time together. We ended up in the same flight. And then there was actually a seat open next to her on the plane. And so we sat together. We hung out for like 6 hours, child-free, without access to the internet, and just had this like incredible, lovely friend time, and the kind of time that's so hard to cultivate in other spaces. And I don't think I've ever been so grateful to like be stuck on an airplane in my life. And it was just like, I love those serendipitous moments. And it was, so it was like a lovely little gift in the middle of a very busy week.
Yeah, I'm glad you had it. And And I will tell you, yeah, serendipity, those moments of serendipity, I wish we could just cultivate them in a lockbox or something. And
Yes.
yeah. But anyhow,
I think our job is to just appreciate those things and those spaces of peace when they happen, right?
Absolutely.
Yeah.
Absolutely. Well, with that, can you commence with the readouts?
I will
Nora?
try. I will try. Though we know you've been busy stockpiling Tylenol and Googling whether tanning beds are leading to brain damage, we're very, very appreciative that you spent some time with us this week. I want to give an extra thanks to our guest, Gregg Gonsalves, for joining us, and to our producer, Jessica Partnow, as always. The music you hear in our show is from the incredible Aham Aluo.
You can find In the Meanwhile wherever you get your podcasts, and follow us on YouTube, Instagram, Threads, and Blue Sky. As always, we appreciate your support to keep the lights on and our therapists in business. You can subscribe or donate to the podcast at inthemeanwhilepodcast.com. New episodes drop every Friday, and until then, we'll see you in the meanwhile.